The Calgary Rural PCN is committed to providing excellent primary care to the rural communities around Calgary by supporting family doctors and the health team members to create the optimal patient's medical home. How long have you been here at the practice?
I've been here since it opened up, which was in the summer of 2012. We were closed for 6 weeks when the flood came in 2013, but we survived and I've been here ever since.
When you think back on where you started, can you tell us about any steps in particular, or what would you suggest to others who might be viewing this? Where would they start?
Where would we start? Well, there's a little bit of a more interesting history to this clinic that I don't know a lot of people are aware of. And that's the history of family physicians not staying in Bragg Creek. So the community got together. They have a group of volunteer people who are actually our board. They did fundraising, they did politically, and they got the clinic going. So in reality, this is the communities, this is the communities, this is the communities. So to be much more sustainable, they really own everything.
So when you think about the patient's medical home and the patient's journey, how did it begin here in Bragg Creek?
I've been in practice for over 36 years in a number of different settings, anything ranging from emerge work to fly-in medicine up north to walk-in clinics to my own family practice. And as a family physician, the only thing I really enjoyed was the family practice, because you get to know the patient, you get to know the family, you get to go through things with them. So that's what a medical home is all about. So I think it was my experience that really pushed that we needed a medical home here in this clinic for our patients.
And when you started this patient's medical home, what was the vision you were trying to achieve?
A place where a patient comes in, is comfortable, works with all our team members, we coordinate everything together and work together and get things done appropriately.
The Calgary Rural PCN provides health team members to ensure the patient's medical home and journey is at the forefront of the clinic's vision. Who in the clinic would you say is involved in the medical home?
Everybody. Everybody from the sense of the physician, the nurse, the receptionist. If you happen to have other health professionals, which unfortunately we don't because we're a small clinic, plus everyone in the patient's family, hopefully.
So with our team within the clinic, it's involved MOAs, doctors, and LPN, and I think we all each do our part to connect with patients. It's not just the doctor, it's not just myself as a nurse, it's everyone really coming together.
Can you tell us what your part is?
So I am a licensed practical nurse, so I room patients, I help out with the screening. So part of our screening is based on preventative health measures. So making sure your diabetes checks up to date, your blood pressure, all the important vital things that we need to know to help out the doctors with their care.
What sort of things were you doing in the EMR to tidy it up?
I think one of the biggest challenges when I first came to the clinic was getting everyone's charts caught up so we could use the EMR effectively. So getting all those follow-ups into the EMR so we could then utilize it to, just use our follow-up button or generate lists on who needed to come in, when, and
By using the Alberta Screening and Prevention Maneuvers, which gives our family doctors a firm but balanced screening guideline to help with our prevention aspect of our patients' care, what would you say are the main maneuvers you use at this clinic?
I think, again, we've divided a few maneuvers to different team members, and I think the doctors and myself are really good at working, if they see something has not been done, they're really good at working on it themselves, and I do opportunistic screenings.
If you were to tell your colleagues in the Calgary Rural PCN and across the province, we've been successful here, And this is why.
Because we believe in the medical home, because we believe in good patient care. Hopefully that's what we give. Because we believe in team working.